Some health insurers are rolling back waivers for COVID treatment fees. The waivers helped cover costs for insured patients who got really sick and ended up in hospitals battling COVID-19. So the question now, what does this mean for you? Julie Appleby with our partners at Kaiser Health News is here to explain. Julie, good morning and thanks for joining us. So some insurance companies have already ended these waivers. Others are in the process of it. So why are they changing their policies now?
Well, let's look back at why they did it in the first place, right? So back in the early days of the pandemic, remember, people were not going to the doctor. They were not going to the hospital if they could avoid it. So insurers saw that their spending was going way down and they knew their profits were going to be looking pretty good. And at the same time, a lot of people were hurting. A lot of industries were hurting. So they said, what can we do that would not only help our customers during tough times, but would also be sort of good public relations and may have some political effects as well. So they voluntarily said, we will waive these co-pays and deductibles for treatment costs for COVID diagnosed patients. So they put that in place early on, and that continued until you mentioned, until fairly recently. A lot of them are rolling it back, not all of them are. But one thing I want you to remember, Congress did pass some rules on a separate issue. They said that insurers need to cover the costs of COVID testing in many cases and the vaccinations when they came out. And that is still in place. That has not changed. So we're only talking here about the waivers of the co-pays and deductibles for treatment costs.
Got it. So moving forward, if you or I catch COVID, what sort of bills might we get stuck with?
Well, if you end up in the hospital, it's a lot of money, right? So your insurer might get billed tens of thousands of dollars for this. Your portion of that's going to depend on your deductible and your copay. But remember, most people have fairly high deductibles, right? It's a couple $1,000. It could be $5,000, $6,000 before the coverage kicks in. And then you've got some copayments. You might be paying 20% of this and 10% of that. So it can really add up to a lot of money if you are hospitalized.
So some people may be getting a rebate check from their health insurer this summer. Can you tell us more about that?
Sure. That's under the Affordable Care Act. Insurers have to spend between 80 and 85% of their premium revenue on actual medical care. So that's why one of the concerns was that maybe they wouldn't spend that much this year. And then if they don't meet that target, they have to issue a rebate. Well, the estimates are they didn't meet that target in many cases, and about $2.1 billion has to be refunded. So what does that mean for you? If you buy your own plan under the Affordable Care Act, the average rebate this year is expected to be about $300. So you might see a check sometime in late summer. If you work for an employer, the average rebate is expected to be about $95 per employee, but don't necessarily expect to see that in your paycheck. Employers can decide how to use that. They might use it to offset future costs going forward.
Interesting. Okay, Julie Appleby with our partners at Kaiser Health News. Thanks for walking us through that.
Thank you.